Wrist pain, causes and treatment. Sprains and strains are common causes of wrist pain. While wrist sprains involve an injury to the ligament, wrist strains involve injury to the muscle. Both injuries are very common among athletes and those at a high risk of falling. When the hand strikes the ground or a nearby object under the force of a fall, it bends the hand back towards the forearm. This action can stretch the ligaments connecting the wrist and bones of the hand beyond normal range of motion and possibly cause tearing or breaking of the ligament. Being hit in the wrist, applying extraordinary pressure to it, or twisting it can also cause a wrist sprain. Wrist sprain symptoms include bruising, pain, swelling, warmth, tenderness, and a popping or painful stretching sensation in the wrist area. A wrist strain is an injury to the muscles and/or tendons of the wrist. The bones at the wrist and soft tissue, including nerves and blood vessels, around the wrist may also be involved in the injury. This injury is usually caused by a blunt force injury, extraordinary pressure or stress, or long-time overuse of the muscles and tendons in the wrist or forearm. Wrist strain symptoms include redness, swelling, pain upon stretching or movement of the wrist, forearm muscle spasms, and loss of wrist strength. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the Sinew herbal ice on your wrist to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the wrist. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your wrist with acute sinew liniments to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activities. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your wrist with chronic sinew liniments to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the Sinew Injury Poultice on your wrist to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. Soak your wrist with the Sinew Relaxing Soak to relax muscles and tendons that are in spasm, ease joint pain and stiffness, and improve range of motion. The Sinew Relaxing Soak is particularly useful if you feel restricted mobility in your wrist. The soak is used by immersing your wrist with the soak in a pot of water. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.